Hey everyone, Dr. Anya Costello. I'm a facial plastic surgeon. Almost every day, patients ask me about the incisions for a deep plane face and neck lift. I'm very particular and I pay a lot of attention to detail when I'm closing the incision because I understand how important it is for the final result. I start my incision in the temporal area, the temporal tuft, which is right up there. My patient here is a year out from a face and neck lift. And I place the incision slightly behind the hair so that allows for the hair follicles to grow in front of the incision and therefore hide it. I continue my incision down this way and I place it behind the tragus, this little piece of cartilage right here. I do not place any tension right here because if I place tension here, that would cause the tragus to pull forward as the ear heals. I continue on with my incision in this crease between the cheek and the earlobe. I make sure to not pin the earlobe to the cheek. Naturally, the earlobe is free and is not attached to your cheek. When it becomes pinned and attached, that is called a pixie ear deformity, and that doesn't look natural, and it is a telltale sign that someone had a facelift. The incision then is hidden behind the ear, so it goes right behind there. And if there's a significant amount of tissue in the neck, if a patient has a heavy neck or there's a lot of skin, I do need to extend the incision and I follow the hairline. And again, I put it a little bit behind the hairline so that the hair can grow through the incision, which will allow a patient to not be self-conscious when they're wearing their hair up. Incisions for the face and neck lift are something that patients have a lot of anxiety about and are very concerned about, which is totally understandable. But I make sure to pay a lot of attention to detail as I close these. I use very fine sutures and pay a lot of attention to detail and probably take more time than a lot of people as I close my incisions. The key thing is that I create my incision design in a way that there's no tension on the incision. It heals very fine, and with enough time, it is almost imperceptible. If you have any questions, just shoot me a DM or give us a call.